Hello, I'm Marie Story, Corporate Wellbeing Consultant and Team Leader from Walsh Duffield Companies. Today I'm here to talk about preventive care and your health. Preventive care consists of measures taken to prevent diseases rather than curing them or treating their symptoms. There's significant research demonstrating that increased use of effective preventive services will result in less suffering from ailments or chronic conditions that could have been prevented had they been detected or treated early on. Preventive care is often more cost-effective than treating diseases once the symptoms appear, and some preventive care services even save more money than it costs to implement them, which is fantastic news. A little bit more on preventive care by the numbers. 75% of healthcare spend in the United States is related to treating chronic conditions, and 7 out of 10 Americans die each year from a chronic condition. This could be type 2 diabetes or heart disease, cardiovascular disease. But there's great news. Due to healthcare reform, many preventive services are offered at a $0 copay. And what do these preventive care services consist of? Healthcare services are focused on helping you maintain good health when we're talking about prevention. Regular medical care focuses on treating illness. We really want to keep you from getting sick in the first place. What does preventive care entail? This could be physical examinations, health screenings, lab tests, counseling, and immunizations, just to name a few. For adults, we're specifically talking about blood pressure and cholesterol checks, and these are important because blood pressure is very much a risk factor linked to cardiovascular disease, which is the #1 killer for both men and women. Cholesterol screening is also important because 1 in 4 adults with high cholesterol will suffer from a heart attack. We also really want to know which vaccinations we're due for, and our physician will help us with this. This could be flu, hepatitis, tetanus, shingles, pneumonia. Those are just to name a few. They're also going to know what are your age-appropriate cancer screenings. These will be colorectal, cervical, and breast cancer screenings for women and prostate screenings for men. And now included in your well visit, you might also see that there's an assessment that'll talk about depression, other mental health issues you might have, substance and tobacco use. And this is because we know how important mental health is, and your physician is really going to be the gatekeeper for your health and will be able to refer you to a professional if you need more help in terms of your mental health and well-being. It's also really important to know your doctor. Find a doctor you can have a good relationship with. You're going to want to be with them year over year and feel as if you can talk with them about the concerns that you might have. If you don't currently like your primary care doctor, maybe ask around to friends and family and find out one that someone really recommends that you trust. From there, you want to be open and honest with your doctor. You want to be able to talk about them with your concerns that you might have, be able to share any medications or family history you have, or even supplements that you're taking. Really open that door. Ask questions as well. It's very fair when your doctor is suggesting treatment or preventive measures to ask follow-up questions and really understand why they're recommending what they're recommending. And then if you feel good about what your doctor is telling you, you really want to follow their instructions when it comes to prescriptions or follow-up appointments. They're really trying to make sure that you're getting the care that you need. If you're ever questioning what your doctor is saying, it never hurts to get a second opinion when it comes to your health. That's really a priority first and foremost. And then, of course, I have to talk about healthy lifestyle choices because this is really at the heart of preventative care. Healthy lifestyle choices include avoiding tobacco and alcohol, of course. Exercising regularly in a way that's fun and enjoyable for you is really the most important. Maintaining a healthy weight. Your doctor is going to know and screen for obesity and BMI or body mass index and be able to tell you if your weight's on track. We know that having a healthy weight is a huge way to reduce your risk for chronic disease. Eat a healthy diet rich in fruits and vegetables. Many of us are lacking in fruits and vegetables in our diet, and this is a great way to really prevent chronic conditions from developing down the road. And then manage stress as well. Like everything else, this is very unique to you as an individual, but find a way and talk to your doctor if you feel like you're not managing your stress well. They might be able to suggest different ways to manage your stress. This could include meditation, gardening, walking, doing puzzles, reading books, whatever it is that works for you. You want it to be enjoyable and healthy in a positive way that you can cope with stress. And then, of course, I want to talk about not delaying treatment. Don't delay treatment because you're worried about costs. As we've indicated. The costs are usually greater when we wait until a condition is much further down the line. Prevention is really the key and the best way to save your money, but most importantly, to keep you healthy in the long run and improve your overall quality of life. So let's not delay treatment if we ever are concerned about our health. And then for any questions you might have, contact your primary care doctor. Ask them about what's included in their routine care or their philosophies on health and well-being. Always follow up with your insurance provider. They can tell you what's covered as a preventive service and what you have available for a $0 copay. And then, of course, your HR team can talk to you about the benefits that you have available to you and how you can best utilize them. And overall, we're just looking for you to really have the best health and well-being that you possibly can and to keep you safe and well. Thank you.